morning addresses two issues. First, the nurse is addressing the client's need for sleep. Sleep-deprived clients are at risk for injury. Rest is also a priority when applying Maslow's hierarchy of human needs. Secondly, the nurse is showing concern for the client by validating the client's concerns. The last communication question is in Test 8, number 8, and addresses therapeutic communication when the family is involved. A 78-year-old client is admitted to the hospital for an exploratory laparotomy. The client's daughter says to the nurse, "I wish I could stay with my father, but I need to go home to see how my children are doing. I really hate to leave my father alone at this time." The best response by the nurse is, 1. Your father needs opportunities to be independent. This will help him become self-sufficient. 2. Your father is capable of taking care of himself. Try to allow him more independence. 3. Stress is not good for your father at this time. Perhaps you could call your children. 4. You're feeling concerned for both your dad and your children. Let me know when you're leaving and I'll stay with him. Number 4 is correct. You're feeling concerned for both your dad and your children. Let me know when you're leaving and I'll stay with him. An important test-taking tip is recognizing that the client in this scenario is the daughter. The nurse is using the tools of empathy and offering self by recognizing the client's feelings and concerns. Also, by offering to stay with the father while the daughter is away, the nurse is offering self. This is a very good nursing response that addresses everyone's needs. Although this question may not appear realistic in a hospital setting, remember to answer questions using the most idealistic approach. The next topic for discussion is defense mechanisms. Defense mechanisms are the unconscious operations used to defend against anxiety, stress, and relieve emotional conflict. The NCLEX RN exam will test your understanding of healthy and unhealthy use of defense mechanisms. The next two questions are related to defense mechanisms. The first question is from Test 5, number 10. The question tests your understanding of specific defense mechanisms and is fairly easy. A client does not return her mother's greeting and instead lies down on the bed and curls up in a fetal position. The defense mechanism the client is displaying is 1. Fixation, 2. Symbolization, 3. Repression, 4. Regression. Number 4 is correct. Regression represents a dysfunctional attempt to reduce anxiety and conflict. The individual regresses to less mature behaviors, such as a fetal position, to reduce feelings of anxiety. Other examples of regressive behavior are temper tantrums in adults and thumb-sucking in older children. Regression is a commonly used defense mechanism. The second question comes from Test 5 and is number 96. This question is related to reality testing. Reality testing is often impaired in psychotic clients. When reality testing is impaired, the nurse can expect the client to use coping mechanisms or defense mechanisms excessively. The question states, which of the following statements about reality testing is not true? 1. It is an ego function. 2. It is the capacity to distinguish thoughts, feelings, fantasies, and other experiences which originate inside the individual from those which are part of the outside environment. 3. It is impaired in psychotic individuals. Or 4. It is impaired in persons who are mentally retarded. The correct answer is number 4. Reality testing is not impaired in persons who are mentally retarded unless they are also diagnosed psychotic. Reality testing is an ego function that is impaired in psychotic clients. You can expect excessive use of defense mechanisms with a schizophrenic client in an attempt to protect the ego from overwhelming anxiety. Common defense mechanisms seen with psychotic individuals are fantasy, denial, regression, and projection. Let's move on to the next topic for discussion, anxiety and anxiety disorders. We have all experienced varying levels of anxiety at some time in our life. The client in the hospital is especially vulnerable to anxiety during their stay since they are in an unknown environment experiencing unknown procedures. It is important to remember that the same nursing process is used with all anxiety disorders, whether they are functional or dysfunctional responses to a perceived threat. The goal is to reduce the client's anxiety. The next 5 questions will relate to anxiety. Test 4, number 64, is an example of severe anxiety and is a moderately difficult question. The question reads, the best approach for the nurse to take initially with a client who has severe anxiety is 1. Move the person to a calm, non-stimulating environment. 2. Encourage expression of feelings without attempting to modify defensive behavior. 3. Lower the client's level of anxiety by offering medication. 4. Suggest the client engage in some autonomic behavior such as pacing to reduce his anxiety level. The answer is number 2. Encourage expression of feelings without attempting to modify defensive behaviors. The nurse should encourage the client to express feelings and listen. Remember that encouraging expression of feelings and active, non-judgmental listening are always good choices. A client with a severe anxiety disorder will need support initially to help him gain more control over his anxiety. Although you might want to move the person to a quieter environment, as stated in choice number 1, the initial intervention for the nurse to provide for a severely anxious client is to remain with them. There is no indication for medication until the client reaches a panic level of anxiety. The next question again tests your knowledge on anxiety. This question is from Test 5, number 79. It is very important to know the correct nursing response to the anxious client. An important tip to remember is to use therapeutic communication that will reassure the client and that addresses the level of anxiety your client is experiencing. The next question is a moderately difficult one and reads, how should the nurse respond to the anxious client who states, I feel like I'm going to die. Am I having a heart attack? Number 1. Reassure the client that nothing bad is going to happen to him. 2. Encourage him to reduce his anxiety by physically pacing or trying some other relief behavior. 3. Respond to the fear he has expressed by stating that he is not having a heart attack and will not be left alone until he is feeling more comfortable. 4. Tell him, no, your problem is severe anxiety. Number 3 is correct. The nurse will need to respond to the client's fear by stating matter-of-factly that he is not having a heart attack and then offer to stay with him. Clients with a panic level of anxiety need to feel someone understands and they will not be left alone. Another test-taking strategy is to look for the choice in which the nurse offers self. Be sure not to give false reassurance to the client, as in choice number 1, and always respond directly to any questions the client asks. Obsessive-compulsive disorders are symptomatic of excessive anxiety. Dysfunctional, maladaptive behaviors are used to avoid increasing anxiety. The client may be pacing, talkative, and engaging in ritualistic routines. In the next question, Test 6, number 54, we will look at how the nurse responds to a client's ritualistic behaviors. Initially, which of the following actions will the nurse most likely consider in dealing with an obsessive-compulsive client's ritualistic behaviors? Number 1, confront the client about the senseless nature of the ritualistic behaviors. 2, set limits on the behaviors so the client can better conform to the unit rules and schedules. 3. Isolate the client for a period of time to lower his anxiety about offending others. 4. Plan the client's schedule to allow extra time to perform the rituals to keep his anxiety within manageable levels. Number 4 is the correct response. Excellent choice. If the nurse does not allow the client or stops the client from performing the ritual, the anxiety will increase. It is important that sufficient time be allotted for the client to perform his rituals early on in his treatment to help him keep his anxiety level manageable. The last question we will review on anxiety is on the pharmacological management of an anxious client. Benzodiazepines are often mentioned on the NCLEX RN exam because hospital clients